Hello, humans. Welcome back to Dr. Rose Helps You Hear. I'm Stephanie Rose, and I'm an audiologist. Today, we're going to be talking about Meniere's disease. First off, I just want to say thank you so much to my 500 subscribers. I'm super honored to be a hearing nerd with you guys, so thank you so much for subscribing. Some of you hearing nerds out there might notice that it's been a couple of months since I've made a new video. And part of that reason is that my Cochlear Hydrops has now become Meniere's disease. Meniere's disease, well, what is that? Well, it's an inner ear disease or disorder that's characterized by dizziness and hearing loss. There are actually fewer than 200,000 cases diagnosed in the United States per year. It usually starts off as unilateral, but it can become bilateral. There is no cure, unfortunately, but there are treatments out there, so have hope. Meniere's disease can happen at any age, but it's most common for younger to middle-aged adults. I was first diagnosed when I was 26 with Cochlear Hydrops, and then just recently in the last couple of months, I've started with the Vertigo. So I went about 12 years before having any vertigo symptoms. So let me lay out the actual symptoms of Meniere's disease for you. The first thing is fluctuating low-frequency hearing loss, and then you also have recurrent vertigo. So vertigo is a spinning dizziness that can be anywhere from mild in nature to severe in nature, and it can lead to nausea and even emesis or vomiting, and it can really be very debilitating. The other symptoms of Meniere's disease are characterized with tinnitus or ringing in the ear, and this can have several different sensations, anything from a hissing sound to roaring, or even like a buzzing sensation, and I get more of the buzzing, roaring sensations. The last symptom is called ear fullness or aural fullness, and this feels like there's almost like a water balloon way deep in your ear inside of your cochlea. We can also have ear fullness from other disorders like TMJD or a jaw disorder. Sometimes middle ear infections can feel like you have fullness in your ear. So it's important that you see an ear, nose, throat doctor or an otologist if you have any symptoms of Meniere's disease, so that they can quickly rule out any other sort of pathologies that might be causing your symptoms. The next thing I'm going to talk about is that this is a fluctuating sort of condition. So after an episode, you might have no symptoms at all. Your hearing might rebound to normal. You'll have no more fullness in your ear, no more vertigo episodes, and maybe the tinnitus also dissipates. So some people refer to this as remission. I don't really consider it remission because I feel like that should be more for things like cancer, but maybe it does make sense. If you've had a disease or a condition that's exhibiting symptoms and then suddenly they're gone for long periods of time, that is kind of like a remission. So that's interesting. When you go to see the doctor, you want to make sure that you have a list of your symptoms handy so that you can recall what they are. You want to let them know when they're happening, how often they're happening, and kind of where you are when they're happening. This helps the doctor to diagnose you and to triage what kind of treatments you should start off with. They also should be running other tests. So when I was first diagnosed with Cochlear Hydrops, I had a sudden low-frequency hearing loss, and I was given an MRI of the internal auditory canals with and without contrast. It's called Gadolinium for the kind that they gave me. None of it hurt or anything. It just took some time, and it was a little loud, and they give you some ear protection when you're inside the MRI machine. And within about 20 minutes, I was done. And at least this could rule out any other things that could have been blocking my hearing, such as an acoustic tumor or a vestibular schwannoma, if they were more concerned about someone with vertigo. The other tests that they might run to see if there's any sort of other things contributing to the Meniere's disease, one would be blood tests to see if there's any sort of autoimmune response that could be causing the hearing loss. So that's sort of related, and it's called autoimmune inner ear disease. And it just so happens that I was diagnosed with an autoimmune disease back in November. And it's undefined. They don't know what it is, but it is characterized by inflammation. So kind of interesting. Vertigo from Meniere's disease usually lasts anywhere from 20 minutes up to an hour or so, and at the very most 12 hours. It never lasts beyond 24 hours. So that is also another important note you need to take when you go to see your physician about how long your episodes are lasting, because that can differentiate between other types of vertigo and other diseases of the ear. Although the exact cause is unknown, we do know that there is a buildup of endolymph inside of the inner ear, and for whatever reason, it is not regulating itself and it builds up. We can see this on the audiogram, on the hearing test. So the inner ear is like a spiral snail, and inside there's fluid. There's also a little membrane with little tiny hair cells that go along the membrane that are tuned from high pitch to low pitch in the center. So when it builds up the swelling with the fluid in there, it's encased in bone, so it has nowhere to go. And this puts a bunch of pressure on the center of the snail, and this is where, or the cochlea, and this is where the low frequencies happen. So you see a low frequency rising into normal hearing when it's in this young adulthood stage and there's no age-related hearing loss yet. So that's really interesting. I've also been told by other otologists that over time they see their patients go from a low frequency into normal, into a tent shape, and then it just goes flat and then further down the audiogram. So the hearing loss can eventually be permanent, and some people even require cochlear implantation. Right now, I'm able to get away with just wearing a hearing aid when I have a fluctuation. And I've also found it really interesting that now that I have the vertigo, I'll get the hearing loss first with fullness and some tinnitus, and then the tinnitus will sort of subside, and then the vertigo will hit. And then when the vertigo is done, my hearing is suddenly back to normal. So I think it directly relates to the pressure that's building up in the inner ear, and then suddenly that pressure is relieved. I don't have any more aural fullness, no more hearing loss, and the vertigo is subsided when it's done. So that's a very interesting combination of events, and I haven't really heard that from Meniere's patients in that order. That could speak to it in that fine of detail. So I hope this helps anyone out there who's researching Meniere's and is possibly in the field. Other causes that I found in the research can be related to viruses and sometimes genetics. So sometimes you can be predisposed to have Meniere's disease. And we've also found in other research studies that Meniere's disease is also linked in family members to people who have migraines and then just vertigo. So maybe they have vertigo without, hearing loss and without migraines, and then maybe another family member has migraines, and then someone else has Meniere's disease. I will share that my oldest sister has Cochlear Hydrops. She's never had the vertigo, but she does get low frequency fluctuating loss from time to time, and her triggers are mostly sodium. Mine are sodium, stress, and caffeine. I think that I was having a little too much caffeine with a new job I started. And so, and also because of the pandemic, we're wearing face masks, so I wasn't hydrating as well as I should. And I think that that's possibly what contributed to the vertigo onset. So we'll talk about treatments next. So the first treatments I'll discuss for Meniere's disease involve medications. The first medication that they might prescribe to you is something for dizziness. So anti-vestibular medications, or vestibular suppressants as we call them, to help you not spin as much. And then also sometimes they will prescribe things that are for anti-nausea because the spinning does give you definitely some icky feelings in your tummy. The other drug is a maintenance drug to help regulate and keep your sodium down so that you're not building up fluid in the inner ear. These are specific diuretics, so you can't go out to the drugstore and buy some water pills. They have to be prescribed by your doctor because they are specific for reducing sodium in the loops of Henle in your kidneys. So they have to also be watched for and look at your kidney function over time to make sure you're doing okay on the medication. I also have to take a potassium supplement with it, and that depends on the type of medication you're taking. So some diuretics don't need it. Some are a combination, and then some you have to add it. So you definitely need to have an ear physician watching after you and looking after your blood work. The other thing that they might suggest is to limit your sodium intake. So if you go on to mayoclinic.com and do some researching on Meniere's disease, they do give a guideline for how much sodium intake you should be having per day if you are an ear patient with Meniere's. Some other people might benefit from balance rehabilitation. This is more for Meniere's patients who have lingering balance issues between dizziness episodes or between vertigo. So you can speak to your otologist about whether or not you would be a good candidate for balance rehabilitation. This is usually done by a physical therapist. We also have an interesting device that I actually did a little bit of research on in grad school called the Meniett Device. And this is a positive pressure that's applied to the inner ear through the middle ear. It's a positive pressure device. There have been inconclusive results. Some people have had good results for reducing vertigo, and some people have had no results at all and continued with the vertigo. So that one is still a little bit up in the air whether or not it's super effective, and it's usually reserved for people who have very difficult to treat vertigo. There are also other treatments that are delivered through the tympanic membrane or the eardrum via injections. So we call this intratympanic injections or middle ear injections. The first type of injection for the middle ear or through the middle ear is called dexamethasone. This is for a steroid that's delivered to the inner ear, which can help with dizziness, but also help with the hearing loss. The second kind of injectable is gentamicin, and this one is gentamicin is really only given to people who are not so worried about their hearing because it is ototoxic and it can affect both the hearing. And then, of course, the main point of delivering it is to wipe out the balance system. So if you have one ear that's working great and sending info to your brain, okay, I'm balanced, and then you have a Meniere's disease ear that's going crazy and it's not sending the right information, your brain gets that information and is dizzy. It's also doing something with your vestibular ocular reflex when it's not sending the correct information. So the gentamicin basically quiets down that bad ear so that it's only listening to the good ear. And then, balance therapy can help to increase the brain's acceptance of going from 2 working ears to just 1 working ear. So I hope that makes sense, and I hope that my hand gestures are helping you guys out. So those are the 2 different types of injectables for treatment in Meniere's. The next and sort of most aggressive treatment that's really reserved for more serious conditions of Meniere's where it's life debilitating are surgeries. They're actual surgeries of the inner ear. The first one is an endolymphatic decompression and shunt. So there's a little sac that comes off of the balance portion of the cochlea that has endolymph in it, which is the fluid that runs through the cochlea. And it's thought that somewhere in there is where it gets regulated. So they actually go in there and they decompress the sac, the endolymphatic sac, and they add a little shunt so that if it does get super full, that fluid has somewhere to go, and hopefully it will help to stave off vertigo episodes. The second surgery is called a labyrinthectomy, and this is kind of the most, I would say that this is probably the oldest one where they just totally take out the whole hearing and balance organ. So they just take it out, and this is really only used when there's little to no residual hearing, because obviously it's going to wipe out the hearing if you remove the cochlea, and the cochlea is connected with the balance organ, so you can't just take out one. So yes, you won't have any more hearing, but also you won't have a defunct balance organ telling your brain that you're dizzy. The third one is a vestibular nerve dissection. So, section. Vestibular nerve section. So that's when they go in there and the balance organ and the hearing organ have 2 separate nerves, and then they just cut the one for the balance organ. This helps to preserve the hearing, and then it also helps to, shut down that bad balance side. and leave you with one good side. And hopefully you only have one affected ear at that moment in time. So some things to be aware of, that probably one of the number one things that I was seeing in just forums that I belong to on Facebook for people with Menieres is that you really have to be prepared for falls. So when you have a sudden onset of vertigo, you have to be kind of ready for it. You need to be watching what your precursor symptoms are so that you can put yourself in a safe place, sit down or lie down, and make sure that you're not going to fall onto something or into hard surfaces, because, you can have a broken hip, you can hit your head, you can pass out from that. And if you live alone, this can be especially dangerous. So you just want to be really careful of falls. The other things that I saw that were really helpful is to keep buckets for episodes around your house. So in every room, you want to have a little bucket with maybe a bottle of water, some of your dizziness medication from your doctor, maybe a washcloth, and a blanket. People find that this is really helpful so that they're not having to navigate across an entire house when you're having a severe vertigo episode, to get some comfort and get some medication so that you can ease your symptoms. The other thing that I have noticed coming across some of my research is that you want to have good lighting. This can help with the fall situation. So if it's nighttime and you're having an episode, you want to make sure you have lights on in the house so that you can see where you are and get to your bucket or get to the restroom in case you need to go there. Now, the words of wisdom that I received from these Meniere's disease groups have been really, really helpful. So I'm just going to read a few to you now. So these are suggestions from actual patients that have Meniere's disease on Facebook groups. So keep that in mind. They said that everyone is different. So one person's treatment may not work for you. So you have to keep going and keep trying different things that are suggested by your team of doctors. And by the way, not just an otologist or otolaryngologist, but an audiologist to check your hearing and your balance, and then also a neurologist to make sure everything else is okay. You want to be prepared, which I already talked about with the buckets around the house. You also want to learn your triggers and be aware that there may not be set triggers. So you might think, oh, it was definitely that chocolate bar I had the other day, for example. But then you might have a chocolate bar next week and nothing happens. So what might be a trigger for one episode may not be a trigger for future episodes, but you just have to keep track and see if there's really common ones that definitely cause it so that you can avoid that. You want to educate your friends, family, and employer about the level of debilitation that episodes and flares can bring. So, like I said, less than 200,000 people are diagnosed with this every year in the US. I rarely come across somebody who knows what Meniere's disease is when I'm talking about it in public. And so I think that this is a very valid point that we do want to talk about, that you can't just be at work and have one of these episodes. You will need to have a safe place to be. You will not be able to read, talk really. It is very debilitating, and that is just the reality of it. The good news is that it doesn't last for a week. It's only, 12 hours and then you're done, or up to 24 at the most. The last thing that I'm going to talk about for this video is the fact that you should have hope. And I loved this comment. This was my favorite comment from someone on the Meniere's disease group. She said, "Do not give up hope. For most of us, it gets easier. Keep up the hearing tests and check in with your ENT, and be ready to accept new limitations and for some new freedoms." So that was really encouraging, that over time, this doesn't necessarily get worse. For most people, it does get better as you learn your triggers and you follow your doctor's guidance and take your maintenance drugs and follow your low sodium regimen if that's suggested to you. So I found that to be super encouraging, that yes, you may have to accept some new limitations, but over time you will have some newfound freedoms. So with that, I hope you guys have a great rest of your week. I hope you're staying safe and well out there. I did get my first shot of Moderna a couple of weeks ago, and I'm going in, or I'm sorry, about a month ago, and I'm going in for my next one, my second shot next week. So I'm really excited about that. If you guys have any questions or comments about Meniere's disease, feel free to drop that into the comments. I usually will reply within a week. And be sure you join some of those Facebook groups for Meniere's disease. Join the ones that have a lot of people. They tend to be more regulated and kept up on. All right, well, thank you so much for watching, humans. You guys have a great one, and I'll see you next time.